Welcome to another short from the Vet Med Digest. The complex interplay between the heart and kidneys in dogs and cats is classified as cardiorenal syndrome or, more broadly, cardiovascular renal axis disorders. This condition involves acute or chronic dysfunction in one organ system inducing damage in the other, often classified into 5 conceptual subtypes based on which organ is primarily affected: the heart, the kidney, or both due to an independent systemic condition. Identifying early kidney involvement in heart disease remains a challenge because conventional markers like serum creatinine are often too insensitive to detect injury until the damage is substantial. For this reason, experts recommend an increased ability to identify and understand the intricate pathophysiological characteristics of these systems through novel cardiac-specific and kidney-specific biomarkers and advanced imaging techniques. Promising biomarkers such as neutrophil gelatinase-associated lipocolin, urinary cystatin B, and clusterin reflect active kidney injury sooner than traditional function tests. For example, elevated serum neutrophil gelatinase-associated lipocolin levels upon admission for heart failure predicted the subsequent development of cardiorenal syndrome in dogs, even when admission creatinine levels were not yet significantly increased. Furthermore, non-invasive imaging like Doppler ultrasonography using the renal resistive index has shown potential to detect very early renal damage, possibly before azotemia, in dogs with chronic heart failure due to myxomatous mitral valve disease. The underlying pathological mechanism often involves low cardiac output and passive congestion of the kidney, which activates the neuroendocrine systems, including the renin-angiotensin-aldosterone system. Clinically, relieving congestion is paramount, as demonstrated in dogs where acute decreases in intra-abdominal pressure rapidly relieved kidney stress and injury as reflected by changes in biomarkers. Managing these cases demands a multidisciplinary approach because aggressive treatment of heart failure with diuretics and angiotensin system blockers, while life-saving, must be balanced against the risk of worsening kidney perfusion. New treatments targeting the underlying dysfunction show promise. For instance, the drug combination sacubitril and valsartan has been shown to improve left ventricular systolic function in canine cardiorenal syndrome models, simultaneously decreasing biomarkers of heart injury, such as troponin I, and kidney injury, such as urinary kidney injury molecule 1 and neutrophil gelatinase-associated lipocolin. This approach also reduced overall kidney fibrosis. In complex, acute presentations, the recognition of cardiorenal cerebral syndrome, where severe bradycardia leads to hypoperfusion of the kidneys and brain, highlights that if the primary cardiac issue is corrected, both renal and neurological injuries can be reversible. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.